What are the billing codes for telehealth services? Have you ever wondered how telehealth services are billed? Understanding the billing codes for telehealth is essential for both patients and providers. Let's break it down in a straightforward way. Telehealth billing codes are specific medical codes that help document and bill for services provided remotely. This includes doctor visits that happen through audio-video or audio-only technology. These codes ensure that healthcare providers receive proper reimbursement for their services, whether they are for telemedicine, remote patient monitoring, or mental health teletherapy. Typically, telehealth services are billed using Current Procedural Terminology codes or Healthcare Common Procedure Coding System codes. It is also important to use place of service codes. These codes indicate where the patient is during the telehealth visit. For example, place of service code 10 is for when the patient is at home, while code 2 is for other locations. Modifiers can be added to these codes to specify the type of telehealth service. This is especially important for audio-only visits. Now, let's look at some key telehealth billing codes and guidelines for the year 2025. For evaluation and management services, traditional codes are still in use. For new patients, codes 99,200 to 99,205 apply, while established patients use codes 99,211 to 99,215. Medicare requires the appropriate place of service code, with code 10 for home visits and code 2 for other locations. Notably, Medicare does not requiring the telehealth modifier 95 for audiovisual visits. As of January 1, 2025, telephone-only evaluation and management codes have been deleted, and Medicare has not introduced new audio-only codes. However, audio-only telehealth services can still be billed with modifiers like 93 for telehealth via audio-only or FQ for mental health visits in rural health clinics. For virtual check-ins, the Healthcare Common Procedure Coding System, code G2012, has been replaced by Current Procedural Terminology, code 90016. This code covers brief medical discussions lasting 5 to 10 minutes and is only for established patients. Remote patient monitoring codes include Current Procedural Terminology codes 99,091 and 99,000 for 157 to 99,000 for 150. These codes cover the collection and interpretation of health data through connected devices. Medicare has also added certain remote patient monitoring-related codes to the telehealth services list. When it comes to mental health teletherapy, standard psychotherapy codes apply. These include codes 90,830 to 90,830, which should be billed with the appropriate modifiers and place of service codes. Providers should always verify each payer's policies, as coverage and accepted codes can vary. It is essential to use the correct place of service code that reflects the patient's location during the telehealth visit. For audio-only visits, applying the right modifiers is crucial. Keeping updated on state laws regarding telehealth payment parity is also important, as some states requiring telehealth services to be reimbursed at the same rate as in-person visits. When setting up telehealth appointments, ensure that the technology supports both audio and video when necessary, but remember that audio only is allowed in certain cases. Lastly, thorough documentation of the telehealth encounter is vital. This includes noting the type of technology used and obtaining patient consent. In summary, telehealth billing in 2025 primarily relies on traditional evaluation and management codes, along with the appropriate place of service and modifiers. Understanding these codes helps ensure accurate reimbursement and reflects the benefits of telehealth in expanding access to care.